Hello, this is Jennifer Barney, and I'll be doing my adult geriatric H&P presentation on the geriatric patient. Patient came in with chief complaint of vomiting and feeling weak. He is a 69-year-old Hispanic male who presented to the emergency room with complaints of vomiting, cough, and generalized weakness for 3 days. Associated symptoms included chills and diarrhea. The patient was unaware of any aggravating factors and had not tried any home remedies or therapies. The cough was described as non-productive, occurred throughout the day, and awakened the patient at night. His vomiting started occurring roughly 24 hours prior to admission, and he states that he vomited 3 to 4 times since then. And the diarrhea started about 12 hours prior to his presentation at the ER, and he reported 3 loose stools in that time frame. Patient did deny any fever, hematemesis, hematochezia, or melena. Past medical history includes insulin-dependent diabetes mellitus type 2, hypertension, interstitial lung disease with a history of bilateral lung transplant back in 2016. Patient has an allergy to heparin, which causes hives, as well as shrimp, which also causes hives. Home medications include prednisone 10 milligrams daily, Prograf 0.5 milligrams PO BID, metoprolol succinate 12.5 milligrams BID, valcyclovir 450 milligrams daily, Bactrim DS 800 milligrams Monday, Wednesday, Friday, albuterol inhalation via neb PRN as needed for shortness of breath, insulin Detamir 20 units at night, and insulin regular 6 units TID with meals. Patient denies smoking, denies drinking any alcohol or illicit drug use. He is married and has 2 children, and he works on a farm. Patient reported a family history of type 2 diabetes and hypertension. His mother is deceased of dementia complications, and father died of a heart attack. For the review of systems, pertinent positive includes reporting fatigue, chills. He denied any fever, night sweats, or weight loss. Denied any new skin rashes, changing in his vision or hearing. Denied any chest pain or palpitations. No shortness of breath or dyspnea on exertion, but he did report a cough. For GI, he did report nausea, vomiting, diarrhea, change in appetite, and abdominal pain. He denied any melena or hematochezia. No changes in his urination. Denied any joint swelling or pain. Did report generalized weakness. Denied any headache or changes in his smell or taste, or any symptoms of depression or anxiety. On presentation, the patient's vital signs were blood pressure 105/88. His oxygen saturation was low in the ER. He was placed on 2 liters of nasal cannula and was setting 92% with respiration 24. His heart rate 99 and temp 99.5. Physical exam, the patient was a well-developed, well-nourished Hispanic male who appears his stated age with some mild pallor. Visual fields were intact by confrontation. His TMs appeared non-injected with good light reflex. Nose, the nares were patent without deformity. The pharynx was also non-injected, and he did have a positive gag reflex. No lymphadenopathy, masses, or thyromegaly. His chest expansion was symmetric. There were crackles to the upper lobes bilaterally. Regular rate and rhythm without any murmur, rubs, or gallops. Abdomen was soft, non-tender, with hyperactive bowel sounds in all 4 quadrants. Extremity size were symmetric. He did have bilateral lower extremity edema at a 1+. All pulses were positive. Color was pink. Did have poor skin turgor. The gait was not tested. He was in the ER stretcher. Cranial nose were grossly intact with positive 2+ deep tendon reflexes bilaterally. Laboratory studies, pertinent abnormals included hemoglobin 15.0, those are normal, and hematocrit 44.9. MCV was elevated at 110.3, MCH at 36.9. The RDW standard deviation was 52.3 and platelet count of 114. CMP mostly normal except a potassium level of 3.1, BUN of 42, and creatinine of 2.1. Chest x-ray done in the ER showing a bilateral lower lobe opacity. Radiologist reported consistent with pneumonia. EKG was within normal limits. Troponins were negative. Influenza A and B were ran. Influenza A came back positive. Patient also had elevated lactate level at 3.4. UA was positive for blood, positive glucose, and positive proteins. Urine cultures were pending. Blood cultures were also pending. Diagnosis includes acute influenza A respiratory tract infection, bilateral lower lobe pneumonia. However, the differential does include possible pleural effusions. Acute respiratory insufficiency, oxygen dependent, lactic acidosis. Acute kidney injury, probably secondary to dehydration. Thrombocytopenia, dehydration, hypokalemia, and the patient's chronic conditions to include diabetes type 2 and the history of lung transplant. The plan for this patient was to admit him to inpatient on the general medical floor, start him on Tamiflu at 75 milligrams POBID, and renal dose as necessary. Due to the patient's pneumonia presentation, until sputum cultures were obtained, starting him on azithromycin 500 milligrams IV daily, as well as Rocephin 1 gram IV Q-Day. Duaneb's also 3 mLs inhalation as needed, or Q6 hours, depending on how well the patient did. Of course, obtain sputum cultures. The differential did include aspiration pneumonia due to his generalized weakness, so maybe consider a speech evaluation for him. Oxygen therapy as needed to keep his O2 saturations greater than 92%. The patient was given a 1 liter normal saline bolus down in the ER, and the lactic acid repeat was pending. He is started on 125 mLs an hour of normal saline and then recheck of that CMP. Additional blood tests might include a serum iron, serum ferritin, peripheral smear for the hypokalemia to give the patient a 40 milliequivalents of potassium, and repeat potassium level in the morning. For the diabetes, we'll monitor his glucose, AC, and HS, and start the patient on a mild sliding scale. Consult the patient's pulmonologist for immunosuppressive management and continue his immunosuppressive drugs. It would also be beneficial to check a Prograf level. This patient was admitted, labs are still pending, and we hope he does good. Thank you. Hope you guys are having a good day.